Welcome, everybody. Thank you so much for taking the time to join us. You've signed up to participate in this webinar, which is entitled Silent Threat, Learn the Risks of Clots with Cancer. My name is Sahar Manzavi Bacon, and I will be moderating tonight's webinar. I am a patient volunteer with Thrombosis Canada, and I have been since around 2020. And I volunteer with Thrombosis Canada because I myself experienced a blood clot in 2019, and it was a deep vein thrombosis that resulted in a rather large pulmonary embolism that very nearly took my life. And at the time that it happened to me, I didn't know anything about thrombosis. I hadn't even heard the word thrombosis. So my main objective as a volunteer is to bring awareness to folks about thrombosis, and that's why many of you are here tonight as well. So we have some wonderful speakers joining us this evening. We have Natalie Quadrans, who is one of our patient partners. We have Kirsten Lenko, who was also a patient partner. And we have Dr. Kirsten DeWitt, who is a hematologist and an emergency physician in Kingston, Ontario. So thank you to the three of you for joining us, and to all of you for joining us this evening as well. So some of our objectives for this evening is to share the stories and experiences of people who have experienced cancer-associated thrombosis. We're also going to be discussing the risks of cancer-associated thrombosis. Something I'm very excited about as well is highlighting the resources that are available to you through Thrombosis Canada, and then also giving you the opportunity to share some of your favorite resources regionally for cancer as well as for thrombosis. So this is just some interesting statistics about who is here with us this evening. These are the participants. When you signed up, you were asked some questions. So we are heavily representing the West End here of Canada, but lots of folks from BC. So hello from out here east. You were also asked when you registered which of these things applies to you. So the vast majority of you are here because you have cancer or have had cancer in the past. And then of those folks, 13% of you have also had cancer and thrombosis. There are 11% of you who are here because you care for someone who has experienced cancer or thrombosis or cancer-related thrombosis. And 10% of you are here simply because you are interested in learning about this topic. So these were a lot of the questions. We kind of did our best to compile the questions that you asked when you registered for this. You told us what it was you wanted to know. So these were kind of the predominant responses that we got. And I present these to you to let you know that we are going to be doing our best to answer the vast majority of these this evening, and we are also going to be able to go a little bit beyond what was asked. So we've saved some of the questions that you've asked for the end of the presentation, more towards the Q&A period. All right, and now we are going to talk a little bit about thrombosis. So before we hear Natalie's story this evening, she's going to be the first one to share and then followed by Kirsten. I think it's important that we very quickly take a moment to define thrombosis. So after the stories, Dr. Kirsten is going to go into a little bit more detail about the risks of thrombosis, why people with cancer are at a higher risk for this, and how to recognize the signs and symptoms and what you can do to prevent or treat a blood clot. But the long and the short of it is thrombosis is a formation of a blood clot. So it's also known as a thrombus within a blood vessel. So this charming little illustration here really helps to highlight what that is. It is while your blood normally flows through your circulatory system, a blood clot prevents it from being able to do so. Deep vein thrombosis. This is a blood clot that forms in the deep veins of the legs, or sometimes they can also form in the arm or the groin as well. If you are experiencing this, you might feel pain in the arm or legs. You might experience tenderness and or swelling, and the affected limb might be warm to the touch, but it also might be red depending on the color of your skin. This is actually something that is harder to see on darker skin. So it's important to know all of the signs and symptoms, since one may not be as obvious. And then a pulmonary embolism. So A deep vein thrombosis is something that can break away and travel through your veins into the lungs. And a blood clot in the lungs is called a pulmonary embolism, or in the plural, it is pulmonary emboli. So blood clots can stop in the lungs because the lungs act as a filter or a net to catch anything solid in the blood. And so if you are experiencing pulmonary embolism, you might feel shortness of breath, you might feel some chest pain, and your heart might beat faster than usual. Pulmonary emboli do not cause stroke or heart attacks. But blood clots in the lungs, they cannot move. So once they're there, and the only thing to do is to treat them. So now I'm going to pass the mic to Natalie, who will share her story with us.
Hi, can you see me now and hear me? Perfect. Hi, everyone. My name is Natalie Quadrants. I am both a cancer patient and a thrombosis survivor. I am really lucky actually to be alive after what happened to me. So I'd like to share a little bit of my story with you. So I've always been an athlete. I used to figure skate as a kid. I played university volleyball, beach volleyball, moved on to competitive snowboarding, and I was on Team Canada as a snowboard racer. So that's one of the, you can see me the top of a mountain. It's hard to see my snowboard, but on cover of back then newspaper. So that just tells my age a bit. I have then got married. I had 2 children, and with these kids we didn't want to change our lifestyle. We wanted to remain active, and we did, all the way up to 2019. And in 2019, unfortunately, I was diagnosed with cancer. It was terminal cancer by the time they found it. So we call that de novo, and it was breast cancer. They told me that I roughly had 2 to 3 years, and the chance for me to survive the next 5 years was only 22%. So not very good statistics. And I happened to have randomly found this because I found a lump in my breast, and that's how I found out I had my cancer. So I started treatment, which you can see over there, but I know the importance of research. I have a Bachelor of Science degree, so wherever I could, I enrolled in studies. And conveniently enough, the first 2 that came up happened to be about lifestyle and fitness. So that actually turned out really well. So you can see I am there, and I was doing one of the tests for the fitness one. So as I went through treatment, I continued to exercise. I worked hard to stay fit, and I remained, active with my kids all the way through. And I am today still active, and you can see on this picture, which it was taken in March of last year. And my kids and I were snowboarding, my son would ski, and he would be devastated to know I said snowboarding. So apologies for that. So if you don't mind going to the next slide, please. Just a few months later, I was outside playing with my kids. It was June 16th. We were doing some geocaching in the woods, running around. And the next day, as I said, I remain active. The next morning, got up, went to the gym at 5:45 to meet my boyfriend there for a 5:40 or 5 cardio. It was cardio that day. And I got home, woke the kids up, shuttled them off to school, and took my dogs with me as per usual, and then went on to walk my dogs. And I was in a big field, a park, where I was walking, and all of a sudden I doubled over. I've never experienced pain like that. It was like being stabbed in the ribs on the right-hand side. So I called my boyfriend, and I'm like, something's wrong. And I didn't know what was wrong. And then as quickly as it came, it went away. And I said, don't worry about it. I'm all good. And so I kept walking the dogs, but I decided to kind of U-turn and go back home because I didn't feel right, but I didn't actually know what I was feeling or experiencing. And So as I was walking home, I left that big field park area. And so I'm a block and a half from my house now. And for anyone who's ever watched a horror movie, there's always some sort of a scene, be it in a school or a house, and you look outside and you're trying to get down one door and it seems like the hallway has just gotten longer. And I looked down the street before I had to turn and I went, whoa, where'd all those houses come from? And so I realized I needed to sit. That's all I knew is I needed to sit and figure out how I walk down my street. And there were no benches, so I sat on someone's decorative big rock in their front yard. And so I'm sitting there and kind of trying to talk myself into walking home, and I felt stupid for sitting on someone's rock. And I tried getting up. Now here's where I kind of lose part of the story in my own head. So it was recreated between my boyfriend, what I do remember, and this woman who was walking across the street who saw me stand up off this rock and just fall right back down on it. So she came up to me and said, hi, are you okay? And the most intelligent thing I said at that point was, I don't know. And she asked me what was wrong, and I don't know. So we're talking, and I say, maybe we should Google a heart attack for women, because maybe that's what I'm having. And I know it's different in women and men. She's like, do you mind if I call you an ambulance if you really think you're having a heart attack? And so I said, what a great idea. I can't believe I didn't think of that. So she called the ambulance, waited for me. And as you can see here, I finally got to the hospital. After some incoherent texts to my boyfriend, he eventually figured out that I was trying to say, I'm in the hospital and I have a pulmonary embolism. And so he came down and met me. So it turns out that I was diagnosed with a bilateral pulmonary embolism, and had I tried continuing to walk home, I probably would not have made it and would have collapsed. So I got to spend the next 3 luxurious days in our hospital, overlooking, and if you don't mind skipping to the next one, with a great meal, overlooking some sort of parking lot, I believe, and had fantastic food. If you don't mind pushing to the next one. So I broke myself out of jail. I needed to get home for my kids because they were transitioning. So I actually, against doctor's orders, don't do that. Find another way, but I did go home against doctor's orders. And that was when I walked in the door and I went, oh yeah, I have to get ready for my kids who arrive in 20 minutes. And that was my first bruise from thrombosis and from being on anticoagulants. If you don't mind skipping to the next slide, please. So that summer, because that had happened in June, last year, my summer was filled of bikini with lots of bruises along my belly. My pulse oxygen meter, which had my oxygen saturation, was my favorite device, better than a phone. I carried it always, and it kind of indicated when I should worry. So as you can see here, 88 was a time that they suggested I go to the hospital, which I did. So I did have a couple of visits over the next few months as I was trying to figure out what was going on with my new normal, I guess. It was about a month later, I had an achy foot and I was driving. I can't remember where I dropped. I didn't have my kids. I got home and I took my running shoe off and I was expecting it to balloon up, and it was normal. And so I went to my neighbors and I'm like, can you look at my foot? It feels swollen. It's heavy. And so as you can see, it's a little bit swollen. But I didn't want to put my shoe back on because I found it very tight. So I did wear flip-flops, and I went to the Emerge. And within a few hours, that feeling of my foot exploding actually turned out to be a deep vein thrombosis in my right calf, or leg. And you can see that is a typical sign that something's going wrong. And we'll talk about, Dr. Kirsten's going to talk a little bit more about that. But I was really glad that I had by then learned what some of the signs and symptoms are, or were, or are, and that I finally did make myself, got myself to the hospital before anything serious happened. Because once it did happen, it had become again a medical emergency, but I was in the right place and I didn't have to worry about getting there. So I really wanted to say thank you for inviting me to share the story, and I'm hoping that my story may help other people. So thanks so much for having me.
Thank you so much for sharing your story. We're now going to pass it to Kirsten. I'm sorry, I think I may have previously introduced Kirsten when it was Natalie, and I apologize if I did that.
Hi, everyone. I'm Kristen Lenko, and I live on Gabriel Island. I basically live off of Nanaimo in British Columbia, live on a little Gulf island. My story, I also have metastatic breast cancer and bilateral embolism in my lungs. So my story starts in 2023 on Mother's Day weekend. On the Friday, I'm going up my stairs to my house and I am breathless. And I'm thinking, I'm a very active person. I hike, I do lots of volunteer work, lots of walking, lots of everything. And suddenly I can't make it up my front stairs without being totally out of breath. Didn't think much of it, just thinking, well, maybe I'm overtired, maybe I'm getting something. Didn't think too much of it. Saturday, just didn't feel myself all day. Came Sunday, it was worse. I tried having a shower and I'm holding myself up in the shower from breathlessness. I didn't have the pain like Natalie had, just very breathlessness and dizziness. My husband's starting to get quite concerned of what was going on in our house and decided to call an ambulance. Went to our local clinic. They're thinking that I have pneumonia, but I actually think she knew it was worse because she sent me to Nanaimo, to the hospital to see what was going on. So I went. When we're there, I get told I have a bilateral embolism in my lungs as well. I got the news I have cancer, which was all news to me. And I'm thinking, great, what am I doing in here and what's going on? Didn't know anything about having an embolism, had no idea. And we are in the hospital and it's now about midnight and they're suddenly talking about sending me to Vancouver or Victoria by helicopter, but they're not sure how safe it is. So they decided to try a treatment in Nanaimo that night. And they also asked me to call in my family because it's a life-threatening situation. At the time, I'm not cluing in it's life-threatening, and I'm saying when they said, please call in your son to come right away. And I'm like, no, it's fine. He's coming on the weekend. I don't need to see him. And it's like, I'm not cluing in that this is life-threatening. So we spent the next 10 days in the Nanaimo hospital while clearing up everything. Very thankful to the staff. When I was released, I still didn't know quite a lot about what I had and about thrombotic events. So we started looking it up a bit, but I'm actually at this point, to be very honest, I'm more concerned about that I'm stage 4 cancer. 6 months after being diagnosed with both having a pulmonary embolism and the cancer, I'm still extremely breathless. But everybody goes, you had a major embolism over your heart. No, it's going to take a long time. No, you have asthma. And I'm like going, there's something not quite right here. A year later, in 2024, again, I guess I guess I like special events or special times because it's the long weekend in August, and I end up in the hospital with pneumonia. At the time, the respirologist was called in because something didn't quite look right with my lungs with all the testing. At that time, they found out I had a condition called CTEPH, which is chronic thromboembolic pulmonary hypertension. It means I have the embolism I had earlier has now turned fibrous in my lungs. So I can't breathe. I'm short of breath all the time, exhausted all the time, and as well as I'm dizzy. So they sent me to Vancouver to have that looked at. The team took a look at it and said, "You're very severe. We're sending you all your information to Toronto." From there, I have been told now with the CTEPH that I'm very severe and that I now have to look at possibly having surgery. In June 2025, I ended up having surgery in Toronto. There's only one team in Toronto that does this surgery. And we spent 6 weeks in Toronto. I spent a month in the hospital. I'm now recovering from going from pre-surgery of going from the living room couch to the bathroom. I would just about pass out on oxygen. Now I can go about 3,000 feet with my oxygen, but I can at least walk and I can at least have a life. It is so important to know that that there's somebody out there. We're a small community, and there is people that will know something and will help you. And that's why I'm here to say, yes, you can have these very life-threatening conditions, but there's so much information out there if you look for it. And Thrombosis Canada has just got so much, and I'm so thankful to them. And I thank you for everybody for hearing my story.
Thank you so much for sharing with us, Kirsten, and Natalie as well. I know it's not easy to share these stories because it's can feel really challenging to relive them. So thank you so much for sharing with us. I am now going to pass it to Dr. Kirsten DeWitt, who will talk us through a little bit more thoroughly what is thrombosis. You got my patient version of it. Here, we're going to dive a little bit deeper.
Thank you, Sahar, and also thank you, Kirsten and Natalie. Your stories were so very important and very, very touching to hear. Could I have the next slide? So thrombosis is a big word and it's quite a scary word. And also the word blood clot can feel exceedingly scary. And that's the same whether you have cancer and a cancer-associated blood clot, or you're simply diagnosed with a blood clot on its own. So I think it's important for us to start, first of all, by explaining the different types of blood clots that people can be diagnosed with, because often, as a doctor, we're very poor at explaining to patients what they have and what they don't have. So thrombosis or blood clots are one of the world's top cardiovascular killers. But actually, a blood clot that causes a heart attack or that causes a stroke is a different sort of a blood clot. And you'll be happy and relieved to hear that they are not related to venous thromboembolism, which is usually a reference to a blood clot in a vein somewhere in the body, or blood clots that have become caught up in the lungs. Next slide, please. So just an overview of the blood clots that cause strokes and heart attacks and how they are different. So people who are at risk of heart attacks and strokes are often people who have different types of risk factors. They may be a smoker, they may have a strong family history of heart attacks and strokes. is associated with having high cholesterol, sometimes having high blood pressure and diabetes. And over the years, the arteries in the bodies can become hardened, and the inside of the artery develops something called atherosclerosis, which is like a rough surface that develops where there's sort of scarring and cholesterol that deposits in the wall. And usually a heart attack is caused when one of those little rough plaques opens up or cracks open. And so the body tries to heal that crack by forming a blood clot, and that can cause a heart attack. And strokes can be caused when blood clots form either in the blood vessels in the neck arteries or in the heart, and they move into the brain. But thankfully, that type of blood clotting is very different from venous thromboembolism. And people who have blood clots in veins and in the lungs are not at risk of having strokes and heart attacks or this type of arterial thrombosis. Next slide. I find in the thrombosis clinic that people who are diagnosed with pulmonary embolism, which is blood clots in the lungs, or deep vein thrombosis, blood clot in the veins, often feel a little bit alone because it's quite normal for them never to have met anyone with that diagnosis. And it can be difficult to understand what exactly the disease is and where it's occurring in the body. So we'll start off by going over how blood clots develop in veins. So there are different conditions in the body, which we will go over, which can lead our blood to suddenly start to clot too much. Everybody needs a little bit of blood clotting in the blood to repair any little damage that's done to veins or damage that's done to tissues. But there are some conditions where the blood starts to clot when it's not needed. And that clotting becomes a vicious cycle, and the clot starts to grow and grow because the blood becomes activated and it wants to go to overshoot to form too many blood clots. And the most common place for that to happen can be in the leg veins, partly because of the anatomy of our legs, because when we sit, we're flexed at the hip and we're flexed at the knees. And that's why people who maybe go on a long car journey on a flight occasionally are diagnosed with deep vein thrombosis. After surgeries or other times when we're less mobile than usual, sometimes we're diagnosed with deep vein thrombosis. When a deep vein thrombosis forms in the legs, which is the most common place for the blood clot to develop in a vein, it can cause these symptoms. So it can cause pain, and patients often say it feels like a Charlie horse in the calf, or pain on the inside of the thigh. It can be sore to touch the leg where it's painful. The leg is often swollen, and usually it's the lower part of the leg, the calf or the ankle and the foot, that becomes most swollen because the blood clot is stopping the blood flowing out of the foot and out of the leg. So the bottom part of your leg is the most swollen. Sometimes when you touch the skin, it feels a little bit warmer, and the skin color changes because there's more blood in the tissues, because the blood can't drain out of the tissues so easily. And as Sahar said, that skin color could be red in somebody who's white-skinned. It could be a dusky blue color. And people who have much darker skin, it's much more subtle to see. It might make the skin look just a darker color. And then if you look really carefully at the legs, sometimes you see some dilated veins under the skin because the smaller veins are trying to carry the blood past the obstruction, the blood clot in the deep vein. So these two examples here, we have Natalie's leg on the left. You can see that there's swelling in the calf, and the swelling goes all the way down to the foot. And you could probably see it's maybe a slightly darker color, just a little bit darker color on the right. And you can see in the other picture that there are some different skin changes on the left leg. It looks a little bit larger in size, and there's that sort of a redness to the skin there. So when blood clots develop in veins, we don't always know about it. If there's a swollen or a painful leg, then you should always go and get checked out in the hospital in case it's a blood clot. But sometimes blood clotting starts in a deep vein and it doesn't really cause any symptoms. And so the first thing that's diagnosed is sometimes not the blood clot in the leg, it's the blood clots in the lungs. So our lungs have two functions. Everyone knows the main function of our lungs is to bring oxygen into the blood. But the second really important function of our lungs is to act like our blood's filter, a bit like the oil filter in the car or the filter you might put in the ducts if you have forced air heating. The lung removes anything solid that's flowing through the blood. And the most common solid thing that can travel in the blood is a blood clot. So if there is some abnormal blood clotting happening in the leg veins or somewhere in the body, then the first place those blood clots will show up is in the lungs. And, you know, a very tiny blood clot might not cause a lot of symptoms. It's possible that you may not hardly notice maybe a tiny bit of chest pain or a bit of breathlessness. But hearing Natalie and Kirsten's story sounds to me like they had a lot of blood clot that had been filtered out in the lungs. And when the filters end up getting clogged up with the blood clots, then the blood can't flow as easily through the lungs. And that's when people feel very breathless and they might pass out or feel like they're going to pass out. And I thought it was really important in Kirsten's story that she specifically told us that she felt really breathless when she was walking upstairs. And that's something I see very, very commonly in people who develop blood clots in the lungs. They come into the emergency department and tell me, you know, I have difficulty breathing, and I always ask, is it difficult to walk upstairs? And sometimes they'll say, you know, I tried to walk up the stairs today and it was so breathless I had to stop halfway up. And when I got to the top, I thought I was going to pass out. And that's a very common symptom with blood clots in the lungs. Blood clots in the lungs can give you chest pain, but it doesn't always, and everybody's different. And that's sometimes the most challenging thing about knowing who has a blood clot in the lungs, is that it can come with very different symptoms. The most common symptom is not so helpful, but the most common symptom is tiredness. And I find people often need to, when they're recovering from blood clots in the lungs, they might need to go to bed in the afternoon to sleep so that the body has enough energy to help repair and break down those blood clots. Tiredness is the number one most common symptom. The second most common symptom is shortness of breath when you're walking or when you're exerting yourself. Something that is not normal for you. It almost feels like you've been running, but you've not been running. And it's always worthwhile remembering if you feel that way. Occasionally people can cough up blood and people can feel lightheaded, and they can be aware that their heart rate is fast. So especially if you have cancer, because cancer puts you at risk of having blood clots, it's important that you know about the signs of a deep vein thrombosis in the leg or blood clots in the lungs. And don't put it down to, oh, you know, it's my cancer treatments, or maybe I'm just having an off day today. It's important to get checked out. And you could be checked out in many ways. You know, if you're in having a cancer treatment, you could ask the staff looking after you there. You could ask your oncologist if you're in your clinic. But if you don't have any appointments coming up, don't leave it, don't put it off. Just go to an urgent care or to an emergency or even your family doctor to get checked out. So again, the common symptoms that are abnormal are difficulty breathing. It can also be pain at the front or the back of the chest, sometimes rapid heart rate and sometimes feeling lightheaded, or pain and swelling in a leg. And usually it's just one leg. And it would usually come on over the course of a day or two, and it can start in the calf and end up spreading a little bit more closer up the thigh. But it's always important to get checked out. So there are several different risks for getting these types of venous thromboembolism, blood clots in leg veins and in the lungs. The number one cause actually is medical treatments and being so sick that you have to be brought into hospital. So when you come into hospital, sometimes you're dehydrated, you end up staying in bed for several days, and sometimes you have surgery. And all of those things increase your risk for developing blood clots in the lungs and in the legs. Cancer, unfortunately, is actually one of the most important risk factors for blood clots. And about a third of everyone who's diagnosed with pulmonary embolism or deep vein thrombosis actually has an underlying cancer that they're being treated for. Being bedbound increases our risks for blood clots. And the older we get, every year that we get older, our personal risks for blood clots increase. And then some people have a very strong family history. So sometimes in my clinic, I find that, I have a patient who's, both brothers have had blood clots and one of their parents have had a blood clot. So when there are people in your first degree family, so your siblings or your parents who've had pulmonary embolism or deep vein thrombosis, it's always important to know the signs and symptoms yourself and never to ignore them, always to get checked out. And then the last thing on this slide is really important for women. While, estrogen is a very important component of both a birth control pill and also for hormone replacement therapy in perimenopausal women, estrogen does slightly increase our risks for blood clots. So that is why your family doctor would always ask before prescribing birth control pill or hormone replacement therapy if you've ever had a blood clot. And if you had, then they wouldn't really want to prescribe that for you. And that can become relevant if you're undergoing cancer treatments, if you're sick in hospital, if you have an infection or you have a surgery and you're also taking the estrogen. Each of these risks add up together. So each individual risk could be smaller, but when you add them all together, then you can end up getting a blood clot. So we'll talk a little bit specifically about cancer-associated thrombosis. So cancer is a strong risk for venous thromboembolism. And that risk is about 9-fold. So to compare to people who don't have cancer, people with cancer have a 9 times greater risk for developing a deep vein thrombosis or a pulmonary embolism. And around about 15% of all people who are treated for cancer will develop venous thromboembolism at some point in their treatment. And it's just always important to remember that, that of course the cancer treatment is long and harrowing and very important, and you wouldn't expose yourself to that unless that was important for your health. Just bear in mind, always have at the back of your mind the signs and symptoms of pulmonary embolism and deep vein thrombosis, because you don't want another issue which you hadn't really thought about to be the cause of you to be more unwell. So cancer can increase risks in several ways. So the cancer cells themselves can release substances into the blood that make your blood want to clot more. And the cancer therapies, that includes chemotherapy and the more targeted, newer therapies for cancer, they all tend to slightly increase risks for blood clots and even radiation therapy. And then, of course, some people who are undergoing cancer treatment need to have a PICC line or a portacath. So either a line that goes buried under the skin of the chest or a line that stays in the arm, maybe for months at a time. And every time we put a piece of plastic into a vein, it can irritate the vein, especially in the few days after it's been first put into the vein. So having a PICC line in the arm is a not uncommon cause for getting a blood clot in the arm when you have cancer, just because there's a foreign material there. It can cause a bit of inflammation in the vein, and the blood is just slightly more likely to cause blood clots. And then the other risks obviously would be if you were admitted to hospital with your cancer, or you had a cancer surgery, especially a cancer surgery on the abdomen or the pelvis. So endometrial cancer, ovarian cancer, bowel cancers, they all have a slightly higher risk of developing venous thromboembolism in the post-operative period. So that would be within about a month after the surgery. And then specific kinds of cancers are slightly higher risk than others. And in particular, that would be brain cancer, especially after brain surgery. When the surgeon actually cuts into the brain material, that can release some factors into the bloodstream which predispose to blood clotting. Ovarian cancer is associated with blood clots, and that's also because sometimes with ovarian cancer there's a mass in the pelvis which can press on the veins that are draining the leg, so that the leg veins are not draining well, and because the blood's not flowing freely, you can get a blood clot. Pancreatic cancer is a strong risk for blood clots. And then other types of cancers we sometimes see blood clots would be in bowel cancer, stomach cancer, lung and kidney cancer, and some of the hematology cancers like lymphomas, leukemias. The more advanced the cancer is, the higher the risk of blood clots from day to day. So advanced cancers present a slightly higher risk of venous thromboembolism. And that's thought to be related to the tumor cells releasing pro-clotting substances into the blood. So we talked about chemotherapy, and then we've got more modern types of therapy for cancers, these protein kinase inhibitors and anti-angiogenic therapy and immune therapy. They can all predispose us to getting blood clots, surgeries, hospital stays, and then intravenous lines also. And then, of course, the things about each of us, which increase our own personal risks aside from the cancer. But unfortunately, each of these risks add up together. So the older we are, the higher our risk. Being immobile, being overweight is a risk for venous thromboembolism. And then having other medical conditions can be a risk. And of course, if you had a strong family history and now you're undergoing treatment for cancers and you're having a big surgery, all of those risks can add together. So it's interesting, there has been some research with people with cancer talking about their blood clots. And, it's easy sometimes for doctors to think, well, the cancer is their main disease that they need to process, and the cancer is more important than the blood clot. But actually, having a blood clot really does impact your life when you have cancer more than we sometimes think. And these are quotes from a research study when patients were interviewed. So the first quote says, "But they don't tell you you're going to get blood clots after chemo." That's the one thing they never said. But we just put it down to, it's just my breathing. Just one item of information that we weren't aware of. So that's why we're doing this webinar, because we want you to be aware of the risk of blood clots. The second quote, "But I didn't realize that that was what was causing the clot, I didn't have any pain or anything. I just thought I was getting short of breath because of the chemo and everything." That is something that I hear quite often, actually, from patients, is that they just thought they were feeling sick after their chemo. And the last quote, "It's only when you start reading up about it, you sort of realize just how serious blood clots are." So I think those are all poignant quotes. 54% of Canadians know that not moving around is a risk factor for blood clots, but only 13% of Canadians know that cancer is a risk for blood clots. So that is something that we're trying to address. So to summarize, cancer and cancer treatments increase your risk for developing a venous blood clot. And actually 50% of these blood clots happen in the first 3 months after diagnosis. The other 50% of cancer-associated venous thromboembolism happens during the cancer treatment. And again, summarize, act fast. If you think you have signs of a blood clot, you should go and get it checked out. So if you have symptoms of deep vein thrombosis or pulmonary embolism, you can always go to the emergency department or urgent care, even if it's at night and even if it's the weekend. Blood clots are preventable in many cases, and actually blood clots are very treatable. And I would say 95% of blood clots are very easy to treat. And 95% of people who have blood clots, they can be managed very easily at home with a simple tablet. So don't be scared of going to get checked out. So how do we treat cancer-associated thrombosis? We treat them with blood thinners, also called anticoagulants. Treatment's given for an absolute minimum of 3 to 6 months, but usually we continue the blood thinners during all of the cancer therapy. And that's really to keep you safe against more blood clots. There's two main types of medications. So nowadays, most people who have cancer-associated thrombosis end up being prescribed a tablet, and it's a simple routine tablet, either a once a day or twice a day regime, depending which one is prescribed. And two examples of these are something called apixaban and rivaroxaban. They don't need regular blood work. They're very easy to take, and they're given in standard doses. The other type of blood thinners is an injectable blood thinner called heparin, or low molecular weight heparin, which we ask patients to inject themselves either once or twice a day. It's much less common that we have to use the heparin injections, and we only use those if it's not safe to prescribe the tablet blood thinners. And now I believe I'm going to hand back over to Sahar.
Thank you so much for that. That was very informative, and again, information that I really wish I had before I experienced this. But I'm so grateful to be learning more about this all the time, and that this information is out there for all of you. In addition to opportunities like this evening to learn, we want to direct your attention to the Thrombosis Canada website, specifically to the patient resources that exist there. So under the patients and caregivers section of the Thrombosis Canada website, if you click on patient resources, there are oodles of resources to be found there, specifically looking at patient sheets that address a variety of different topics. And all of these patient sheets have been created by professionals like Dr. DeWitt, and they've all been made in collaboration with patients like myself. So they are all quite patient friendly. If you are a healthcare practitioner who is here with us this evening, please direct your patients to this information that's here. It is really solid stuff. And if you yourself are a patient and looking to learn more, fantastic information sheets, really great stuff to be found there. And actually, I see one of the questions in the side chat here says that you're on a flight right now and you are looking forward to hearing what one can do on a long flight. And I won't try to answer that myself, but I do actually believe, if I'm not mistaken, that we have a patient sheet specific to thrombosis and travel. So that is one that you'll be able to dive a little deeper into as well. So beyond, we also have all of these great information booklets that can be found on the website as well. There's not just for thrombosis patients, but there's also specific ones for cancer-associated thrombosis. There's a whole patient library for that. So this is a great place to look to support patients with cancer or who have or may be at risk for cancer-related thrombosis. And then I also want to draw your attention to the Thrombosis Canada Clots campaign. I know that there was a lot of information that was shared this evening, and there's a lot to take away from this evening. If I had one wish for you to take away two things, if nothing else, it's please take away the patient stories, because I find those to be extremely impactful, and take away this acronym. These are really, really important signs and symptoms of a life-threatening blood clot, and recognizing those signs can really save your life. And I do not say that lightly. It can make all the difference in the world, because I couldn't vote in the little survey that came up there, but I was experiencing multiple of these, basically all of these symptoms. I was experiencing them, but I did not know that they were signs and symptoms of a blood clot. So I did not think beyond. So knowing this really could have changed things for me, and I hope you take this away with you. There is also a new patient guide that was built it took quite some time to put together. It was built again in collaboration with medical professionals, thrombosis specialists, as well as patients. It is very comprehensive. It is a 29-page guide, and it has a lot of really important information in there. I think an important one that I want to just very briefly highlight are there are some mental health resources within there as well, because whether you're experiencing cancer-related thrombosis or just thrombosis, these can have a pretty big impact on your mental health. And so this is something that I've been advocating for, is that our medical professionals, when somebody has experienced thrombosis, regardless of what the reason, that they are supporting them in seeking mental health support as well. So there's really, really great resources there for you to find. So I hope you'll take some time to take a look at that patient guide. And then we also want to draw your attention to some of the patient support groups that are available out there. This is not all of them that exist. These are just some that we know about. If you yourself are a part of any groups, or you know of any groups that exist out there that are not listed here, I strongly encourage you to add those to the chat. Again, this is a resource that we can compile and share out afterwards. Also want to draw your attention to the mobile app. This is available on both iOS and Android devices. So all of those different resources that I was talking about can be found directly in the app. So it's a free app to download, and I encourage you to take the time to download that this evening. So Kirsten, I do see that there was a question in here about what to do on a long flight. And I think this one feels very timely since they are currently on a flight. So if you could give some quick tips on how we can support, that'd be great.
Yeah, really timely, that question, because I feel every time I take a flight, they have put an extra row of seats in the same size aircraft. So there's really so little room to move. It's really important that you get up to move, even if you're stuck at that window seat. So I would say, every couple of hours, just try to get up, wander up and down the aisles. And then when you're in the seat, it's good to do the foot pumps. You can move your feet up and down, which helps pump the calves. And that's something else a lot of people do. It would be to wear flight socks, just compression socks. They only need to go as high as just below the knee. You can buy them in the pharmacy, but they can be really helpful to reduce pooling of blood in the ankles. So there's less chance of blood clots, and they also prevent the leg swelling that can be quite uncomfortable after a long flight. Those would be the most important thing. And, it's probably more healthy to avoid alcohol, keep hydrated, and drink water.
I see that there's another question here about a risk of thrombosis if in cancer remission.
Yeah, that's a great question. Venous thromboembolism research is still somewhat in its infancy. Research has only been going on about these sorts of blood clots for about 20 years, and the research for cancer patients is even a little behind the non-cancer population. So although we have had some great trials be published recently, there has been no trial yet that tells us, okay, we're going to continue prescribing the blood thinner during all the cancer treatment, but how soon can we stop? So our feeling is that when you're in remission, you're probably fine, that the risk of cancer goes away. And when you're cancer cured, that risk goes away as well. The only thing we don't really know is when is the right time to say that, now is a good time to stop taking the blood thinners. So sometimes I have patients continue for another 6 months or so after they've gone into remission, just to be sure that they're happy and no new health changes, and then they stop the blood thinner after that.
I see another question here about, can a blood clot be a future prediction of cancer? I had a PE in 2017 and not diagnosed with breast cancer until a year later.
Yeah, another great question. Wow, you guys have had such terrible experiences. I'm so sorry. The answer, I guess, is we just don't know. But I do occasionally see that with people, that the blood clot is diagnosed first and then a year later cancer is diagnosed. It's difficult to know, how quickly the cancer develops, but it's a possibility that the blood clot could have been caused by the cancer, even though it hadn't been diagnosed at that time.
And then I know you kind of touched base on this with the cancer remission question, but just to make the distinction between the two, how long after treatment are you at risk of a PE or DVT? Will I have to worry about this for the rest of my life?
So once a cancer treatment is stopped, and if your oncologist is happy that cancer's gone away, then your risk of blood clots is actually much, much lower, and it probably is so low it's almost nothing. Unless you're someone who has a family history of blood clots or something else. And if you're cancer cured, then your risk returns to just the average person in the population. So it's not necessarily something you have to worry about for the rest of your life. We do continue blood thinner treatment usually as long as there's no problems and complications during all of the cancer therapy. So it just depends how long that lasts.
If you are able to do so, we would greatly appreciate any support that you can offer through a donation to Thrombosis Canada. It's donations that make this all happen. It helps to support delivery of evenings like tonight. All of the resources that we mentioned that are available to you, those are all made possible through donations. So if you are able to, that would be wonderful. Thank you again for taking the time to join us this evening. Again, regardless of why you came to us this evening, we were so very grateful to have you here with us. Please tell your friends, tell them about Thrombosis Canada. Please help us raise awareness, make sure that people know the signs and symptoms of a life-threatening blood clot, because knowing the signs and symptoms can save a life. Thank you for being here this evening.